Welcome to ReCoV My Story, Season 2. Today we have a special guest from Pune and she recently recovered from COVID. Welcome to the show, ma'am. And if you could just
Yeah,
introduce yourself.
yeah. I am Dr. Munira Lokhandwala. I am a doctorate, not a doctor, and I am a teacher of English. And I recently I teach in a senior college in Abhidayananda Senior College, Pune. And as you've just been informed, I have recovered from COVID. And well, that's it.
Okay, welcome to the show.
Yes, ma'am.
And would like to listen from you your experience that you went through when you were suffering with COVID.
Yeah, actually, what did happen was, in fact, I got diagnosed a little late because, I did not show the typical symptoms, like I didn't get a fever or I didn't have a racking cough. But I did, as a turn of season, we do get a little bit of on and off a cough and cold. Plus, I had a little body ache. So, I just thought it was a little bit of change of weather which is affecting me. But it was only when my husband got infected and he showed the typical signs of loss of smell that the rest of the family we needed to get tested. And that's when we realized that three of us were positive. That was one thing. Fortunately for all three of us, we were not very severe cases. We did have a little bit of pneumonia, but we isolated ourselves at home and we consulted our doctor. We took the precautions, the SOPs, etc. And we were very, very conscious in terms of checking our temperature, our oxidation levels, our blood pressure levels, etc. And that sort of helped us come out of it without really needing any extreme medical help or something. But we were monitored constantly by our doctor 3 times a day.
Then it's like,
So
initially, like when you are saying that, okay, three family members got affected.
yes,
So, how did you feel at that point of
I know
time?
all of us were very anxious because knowing the history of what is happening to patients all around us, that, the horror stories in terms of hospitalization and, of course, deaths. And, we were initially very anxious and worried that we wouldn't, we may need hospitalization, and then the worry about not being away from family. So that anxiety was there. But fortunately, we got the right medical guidance from our doctor, as well as once we had got established all the tests, etc., and we knew the procedure for undergoing. So the initial anxiety is obviously there. It is bound to be there because we are dealing with a situation, we are dealing with a disease which is unprecedented in that sense. There is no marked cure as such for it. And it's a global phenomena. It is something you can't even step out of. And the thing is, you cannot have people coming in to help you, to nurse you, or whatever. Whatever happens, you have to do it yourself. So that anxiety was obviously there since we were three of us affected. And more importantly, we were worried about infecting our other two members who were not infected. So we had to make sure that we isolated ourselves properly.
It must have been a real challenging time at that point.
Initially, yes, it was a challenge. Initially, 3, 4 days, we were very anxious. But once we settled into it, that acceptance needs to be there. And I think that is the first step to having a positive cure. Because once you accept that, yes, you're unwell, and yes, you have to know that luckily we say in urban cities where medical help is so much available, and there is a lot of things that we can reach out to. So initially, few days, 3 to 4 days, were very anxious, not just for us, even for our for my parents, etc. So everybody was worried, and we did not want to be more pass on anxiety more. So like we decided to stay calm and, just deal with the disease on a day-to-day basis.
That's absolutely true because the moment we accept, then we
Yes.
start understanding the right way to tackle such a thing.
Yes, absolutely.
That's very true. And did you have any low moments while you were recovering?
Yes, I did. In particular, among the three of us, I had the most severe congestion in my lungs, and we had to undergo the HRCC scan. So initially, after the 10-day period, then I was asked to repeat the scan. My scan showed absolutely zero improvement. There was not even 1%. I was not even 1% better. So that was one very low point that I had been taking all the medications. We were taking all the karas plus the steam and the, whatever was recommended and isolation and, trying to be as much as, whatever the COVID
Right.
specialist had told us. Despite that, when I found that my reports showed no improvement, I was very low. I thought now I think this is my next step to maybe going to the hospital. But fortunately, I had a very good physician, Dr. Chawla. She told me that don't worry. In fact, if there is the stagnation is fine, we do not want further growth. So stagnation means now you are in the progress of getting it, you're defeating the infection. So don't worry about that. By the time your 14-day period will be over, you will be out of this, the pneumonia also. So the pneumonia did stay for a little longer, but that was one point when I was very low. Yes.
So it's like it must have been, I can imagine, very devastating at that time, but the right interpretation or let's say suggestion by your doctor
Yes.
was
And then, of course, we were, everybody was worried because after such heavy medication, plus all that, there needed to have been an improvement, which wasn't there. But fortunately, once we realized it, and I spoke to another doctor as well, who's a relative, and she also reassured me that no, this is very normal, which we are very happy that it's not increased, because increase means that, it challenges your lungs even more, and that would mean, and luckily all my readings and all were within the normal range, so that all the pointed to me not getting more worried, and so it was just a worry for a day, and then when I was reassured, I was okay.
what thoughts helped you to stay strong
Well,
before you received the
I
reassurance?
am I am basically a positive person, but I
Wonderful.
must I must tell you that it did feel, there were very low moments, and in which I did write letters to all my family members in case I had some problems and I did not survive it. So I still have them, in my folder on my laptop. And these things, you cannot prevent, because even though we all know that we are mortal, we do not want to die today or tomorrow. So that's the thing, which these things do this thing. But I must tell you one thing, that the being in, I would do my pranayam, and I would like to share that I also believe in the power of prayer, and therefore keeping regular with my prayers, etc., in a sense getting my mind calm helps me get over that low phase which I would feel on and off. There's a dip, on and off.
That's really nice. Like, when you say that, okay, despite of the fact that one is positive, there could be moments and there is a bounce back also.
Yes, yes, obviously. I mean, how much ever we should be positive, but we are also human, and we do have our weaknesses, and therefore those low moments are bound to be there with each person. But when we learn to cope with those low moments, and this coping mechanism has to be there from within. Of course, you do have family support, but still, you have to be convinced from within. Only then the positivity can work.
That's interesting because
Yes, ma'am.
we do look around for some positivity, for some coping, let's say support system. But
Yes,
you have rightly pointed out it has to be first from within when you accept and then you work from within.
yes, definitely.
That's nice. And would you like to share some of your takeaways from this entire experience of going through COVID, wherein which
Uh,
was very different when you listen, somebody is affected, and once you go through yourself.
yes, I started valuing the things which actually do really matter. Uh, More. See, in our day-to-day struggle in our life, whether it is job or family, we get so carried away by the things that we want to achieve, from the things in terms of material gains as well. Okay, you have to pay the loan of your house and you need to get this education things completed and you need to build up this way, the way you want it. When, everything cuts down and it is to the basics of your isolation in your room, where your survival depends upon you being inside a cocoon, literally, you start a lot of introspection. Of course, literally now we are in a sense blessed because we have a lot of devices which help us remain connected with our friends, etc., despite us not being able to physically meet. So I could reconnect with a lot of my contacts which were non job related. Like it could be like some faraway cousins, some friends, and we did bond over over the telephone or over the messaging, and a lot of introspection did take place about things which really matter in terms of what you really want to do. So that reconnection I felt, that in our the race for survival, etc., the race in which we embroil ourselves, we lose a lot of human contact, and
So,
that is one thing which I wanted to reconnect, and did a lot of those things, and get got a lot of course, the work backlog. I could get myself a little more organized, and that's one. But I felt I think the best thing was the human contact that I could nurture.
so you rebonded with the forgotten ties.
Yeah, I rebonded with a lot of my friends and relatives whom I would be just a WhatsApp hi, during a festival greeting. But otherwise, also, like, means the will wasn't in place along with the time. So the time factor always matters with us who are racing here and there. And now at that time when I realized that, okay, I was isolated and I needed to meaningfully spend my time, I thought the human connect was missing in my life in so many years. Whatever, with the bringing up of the family or making your career. So that is where I felt I could reconnect.
So it was recovery with a pinch of salt.
Yes, definitely.
Okay, and a wonderful recovery, Alhamdulillah, and that I'm really happy.
Yes, ma'am. Uh,
Yeah.
yeah, the only thing is one more thing physically, in a sense, even though you try, but one thing is, I mean, that is true of almost all the COVID patients whom I've interacted with, the those who have recovered, that it takes you a while to build up your strength again. So, along with a good, healthy diet, a sort of a mild exercise routine after you have been declared COVID negative should be followed, in terms of breathing, in terms of light exercises, in terms of extremely healthy food, because it needs to it does take away a lot from your system. It doesn't show. It is not always manifested during your 14-day, because we were mildly infected. So those who are more heavily infected would have more side effects of the medication as well as the disease. So this is in terms of the physical this thing. But mentally, yes, you have to be very positive. You have to understand that this is something which you can cope with. and use the time instead of going into the self pity and all that mode. We can go into things like, maybe read up. I mean, I did read up quite a lot, all the missing, things which I needed to read, and I did read up. I indulged in a lot of prayer, and also a lot of reconnection with a lot of people.
So, along with rebonding, you rekindled your own hobby.
Yes, I did. Yes, I have always been an avid reader, but sometimes your favorite books get kept away for another time. That maybe when I have a little more time, I would have. So my bookshelf was filled with books which were not read. So I took this opportunity to do that as well.
Excellent.
Yeah.
And any special message that you would like to share with all the listeners, especially those who are recovering from this COVID right now?
Yes, one thing is I feel that, today now that I have recovered and looking at so many people who are not so fortunate in terms of recovery, they did not come back from COVID. I would like to say that let us value each day and each relationship and person we come across with, because nothing actually, when we go to the final analysis, nothing actually remains besides the bonding that you share with your family, your support system. Those are the primary things that you need to value and you need to appreciate. See, we all value. I'm not saying that we don't value, but even if you verbalize it a bit and tell them how important they are to you, not when you are sick, but when you are well and good. That goes a long way in, what we lack today is not resources. I think we lack a bit of warmth and humanity amongst us. And this is, in a sense, a collateral damage of modernization and modernity in that sense. So family bondings need to get stronger. Yes, some of us are very fortunate to have good support systems, but even we cannot take anything for granted. Nothing, especially human relationships, should not be taken for granted. That's all.
That's wonderful because I'm sure now the listeners will understand that to maintain the bond within their own family and with friends and colleagues everywhere, it does help in maintaining that that warmth around, being more humane
Yes,
in a broader way.
definitely, definitely.
Absolutely, your valuable advice is very precious, especially for people right now who are looking up and looking around for some positivity, because there
Yes.
is too much of let's say, not negative but raw data that is not being refined.
There is a lot of anxiety. A lot of people are getting stressed more because of what they have heard and what they are threatened with. This is not, there are very small percentage of people go into a very severe state of COVID where its recovery becomes difficult. But most of the people who could have recovered have gone into a very anxious state. They and their relatives have gone into an anxious state and rushed into hospitalization and overdose of some medicines, etc., which could have been handled at home. So perhaps that mental, I'm not saying that every COVID patient should be treated in the same way, but keeping calm and keeping collected and also having faith is very important. And the will to recover, the will to fight the disease is as important as any medicine that you can have.
Totally agree with what you are sharing, and I'm sure listening to you, they will gather their will now to be a more fighter, a warrior,
Yes,
and they will absolutely recover in in less span of time.
yes, ma'am.
Because these stories are very important to be there in the social media so that every person who is recovering, as you have suggested right now, that the anxiety that will be at least dealt with. No, this is something from which they all can recover by faith, by being
Yes,
patient, and trusting
yes,
the process.
yes.
That's really nice. Nice talking to you. And it's like, you feel more energetic by
Yeah.
listening to your tips.
Yes, thank you. I'm hope that I'm able to help somebody in terms of inspiring them to fight or inspiring them. I mean, I agree. I've been one of the fortunate ones who have recovered without too much of problem. But I feel keeping active, even though, I mean, not lying prone all the time and keeping active mentally and at the same time being positive, I think helped me recover faster and was back on my feet as soon as my quarantine was over. Prefer to walk and I prefer my pranayam and yoga.
So following the yoga in a disciplined way,
Yes,
that
yes, yes,
helps.
absolutely. Yes, definitely.
That's wonderful. And
Yes,
with that positive note and positivity, I hope all the listeners will keep in mind and value the bonds that they are building up in the process later on, and valuing the things that they are blessed with.
yes, ma'am.
Thanks a lot, ma'am, for
Thank
your
you.
valuable time.
Thank you, Ina ma'am, for giving me an opportunity to share with you and your hearers, and wish everybody a good, fast recovery and health to all of us.
Thank you so much.
Okay, ma'am.
Take
Thank
care.
you.
Bye.
Welcome. Bye.